Good afternoon. Thank you for attending this HSA Insurance webinar, Understanding the Impact of ARPA on the Massachusetts Broker Community. For more than 50 years, we have worked with brokers such as yourselves to provide an industry-leading customer service experience in the individual and small group market. As attendees log on, just a few procedural notes. More than 100 brokers registered to attend a session today. All registrants will receive a copy of this presentation, along with a detailed ARPA fact sheet. The fact sheet will contain additional ARPA material that could not be reviewed within this 1-hour time frame. The objectives of this webinar are: explain those ARPA provisions most relevant to you, the brokers. Demonstrate in tangible ways its potential impact on our mutual clients and your business. Share how HSA is responding with its non-broker, non-group accounts. Finally, facilitate a conversation about approaches to your broker accounts through the chat function. For the duration of the webinar, all video and audio will remain off. Again, participants can use the chat function to ask questions. We will likely answer technical questions in an ARPA fact sheet supplement if we cannot answer them here today. This webinar is being recorded for training and quality assurance purposes. We will begin momentarily.
Good afternoon, everyone. My name is Naomi Franken. Thank you again for attending. We really appreciate your participation in today's webinar. Many of you know me already, and if you don't, let's connect. Feel free to reach out to me anytime. I'm the sales manager here at HSA Insurance, and before we move forward with the presentation itself, let me introduce my fellow presenters. I'll hand it over to Jeff first.
Hi, everyone. My name is Jeff Rich. I know many of you, and hopefully you know me as well. I'm the CEO of HSA Insurance, and we're presenting this webinar today to make sure as many of our broker partners as possible have a full understanding of what ARPA means to them. And I'll hand it over to our third and last presenter, Michael McDonough.
Good afternoon, folks. My name is Michael McDonough. I'm the president of HSA Insurance, and I recently took over the day-to-day activities for Jeff. I have not met, I don't think, any of you, but I do look forward to hopefully getting to meet everyone this summer. Jeff and I plan on doing a little road show, so look forward to meeting you, and stay tuned. Hopefully you will find this information very helpful. Back to you, Naomi.
Thank you. So, on the agenda today, several topics that we will be covering, specifically. Now, a quick synopsis of what is ARPA, what should you be aware of, and how it will affect you, the brokers. We'll also be talking about our approach to our HSA house accounts, and then lastly, we'll open it up for a Q&A and discussion at the end. Just a reminder that you can submit your questions through chat. We will be monitoring those questions, but we will open it up for a Q&A at the end of the presentation. Now, real quick, American Rescue Plan Act, a really good idea, but it will have implications for us and also you, our brokers. So what is ARPA? On March 11th, President Biden signed the American Rescue Plan Act of 2021. It was signed into law, and it included important updates to certain benefit laws in response to the pandemic. Now, these were most significant changes to the American health care landscape since the passing of the Affordable Care Act, or also called PACA. Specifically, ARPA includes expanded health care premium and COBRA subsidies. Now, for today's presentation, we will really be focusing on those ARPA subsidies. There are many additional changes on the ARPA, but again, we are focused on the subsidies for today. What does this mean? Well, previously, under the ACA, the Affordable Care Act, individuals who fell between 100 and 400% of that federal poverty level will qualify for a subsidy when enrolling in an on-exchange plan. So again, an on-exchange plan. Individuals above that threshold would not qualify for tax premium credit, and the said subsidies cover the cost of that benchmark silver plan, which is that second lowest cost plan, minus the required individual contribution tied to income on a sliding scale. So previously, individuals making 4 times above the poverty level would not qualify for a marketplace subsidy. Now let's look at the recent changes. The affordability coverage changed from 9.83% to 8.5%. And in addition to that, there will no longer be an upper income limit on the premium tax credits for 2021 and 2022. So this means that consumers or enrollees will pay no more than 8.5% of their income towards coverage. Because the federal poverty level standards of 400% has also been removed, the cap is no longer there, consumers could now become eligible for the first time or could see considerable increases in their subsidy limit. So, what does this mean? Well, this could lead to individuals moving off the exchange to non-exchange plan, meaning the connector here in Massachusetts. In addition, and this is important to note, the carriers will migrate accumulated benefits for members that are moving from an off-exchange policy to an on-exchange plan with the same carrier to hold the member harmless for any accrued deductibles and out-of-pocket costs. Now, this could also make it easier and could lead those individuals moving from an off-exchange plan to the connector. Now, it is important to note that, yes, these subsidy updates are temporary. They're in place for a 2-year period. They're active through the 2022 calendar year. However, President Biden has proposed to extend this program, and this is currently in front of Congress. So taking this all together, these changes could mean that many people are moving to the connector that are currently enrolled in an off-exchange plan. But really, should all of them? I'll hand it over to Jeff right now.
Thanks, Naomi. Your world is about to change. Let's linger on that idea for a minute here. Together, our firm and the broker community have had a history of being on the bleeding edge of change. Everything from Romneycare early on to the ACA or Obamacare and now to ARPA. At each step of the way, there was talk about an existential threat to our industry as a whole. And each time, not only have we endured, but we have actually thrived. Will some of your clients benefit from ARPA? Absolutely, and we welcome that. But we do believe that public policy changes, like ARPA, have more than one dimension, and that's worth talking about. And that's what we want to talk to you about today, and that's what we are talking about in a transparent way. We believe if we and you are passive and or disinterested parties, that some customers and clients who may be marginally better off financially or not better off at all will join the connector without understanding what they, in fact, give up in the process. And this may not serve our customers well. And that's something that we really want to make sure that you and your clients understand clearly. So one of the things that's really important here to know is the connector is going to be spending almost $2 million on an outreach program in order to connect to potential clients or people who are potentially eligible for the ARPA subsidies. They are planning to use multiple channel partners utilizing multiple languages as well. And they will work at the wholesale level on things such as TV and Hulu and Pandora, etc., and also right down to the retail level, like newspapers and the sides of T-buses and billboards. None of us have anywhere near this kind of money to remind the off-exchange population how we may offer advantages for some that the connector does not. So their campaign has the potential to be highly effective, as they have access to information sources that the rest of us just do not. The IRS, the Department of Revenue, community groups, they can all provide income, demographic, location data that none of us have access to. This information helps the connector find their target audience very effectively, and it adds up to cost-effective rifle shots as opposed to just wasted buckshot all over the place. The connector has also asked the carriers to send out letters to their off-exchange population. So we have some examples, actual examples of letters that are going out to clients of yours and ours. They may have already received them. They'll be going out sporadically over the course of the summer and into the fall, but they will be direct approaching clients who are off the public exchange to go to the exchange and see if they qualify. So these are happening. Now, we believe that there's 3 population groups which can overlap that could see a large or small financial advantage. And some of these, some of these folks will have the ability to save a considerable amount of money. And in those cases, of course, they should move on to the connector from off exchange. As a matter of fact, we would actually drive them to Boston if they were going to be saving this type of money that's available to them. But not all will be in a position to save that kind of money, but all will be approached by those letters in the connector as we just showed. Now, one of the things that you folks as brokers can bring value to and help out your clients is you've spent years learning, training, and understanding not only the big important issues that consumers or your clients need to be aware of, but also all of the important nuances as well. Things like how to handle college kids aging off, Medicare supplements, limited network plans, and prescription deductibles, to name just a few of the areas that your knowledge and expertise greatly helps your clients. The other part on the seesaw is technology. Our technology is intuitive, quick and easy. We consistently get feedback that it is far superior to other platforms, and in particular, open enrollment management is a breeze with tools such as our Doc Finder that makes it easy to potentially move a client from one carrier to another. One-stop shopping, that is, the idea here is the fewest clicks possible to view the market, and then providing the tools to make a choice is really our stock in trade. And finally, customer service, which is really the key issue, to be frank. We are an industry leader in the customer service front. We survey our mutual customers constantly in order to discover what we do well and what we need to improve. As a result, we have designed, built, and managed a system that not only far exceeds our industry competitors, but it also is in a constant state of improvement. Our servicing is remarkably fast and super friendly, which means our mutual client retention rate remains high, and our clients are loyal to our brand and you. Time and time again, I've had one-on-one conversations with you guys, and the big thing that I find being stressed is the importance of a very strong service model. These conversations over the years have resulted in our laser focus on service, which is in arguably the best in the business. And obviously, I'm not biased at all when I say any of that. No, not at all. But with that being said, I'd like to hand it over to Michael to move through some more slides.
Jeff, thank you very much. Gang, this is Michael. They're going to let me talk for 2 hours, so go get a cup of coffee. So Naomi tried to give you an understanding of sort of what is behind the whole ARPA movement. Jeff tried to give you a summary of sort of what role HSA plays in it. And I have been asked to try to help you to understand what's it really mean to you. So I want to be very clear that nobody on the phone, nobody in this room, nobody in the market would question the logic and the importance of ARPA and how it can help individuals. So I just want to be very clear about that. But I do want to make sure that I take a few moments to try to walk you through really what does it mean to your business model, what does it mean to our business model. I love this slide, the target. Think of the meaning behind a target. It means that somebody is taking aim at something for the reason of hitting the target. This coordinated effort will reach its intended target. The problem that we see is that the intended target is your clients and our clients. $2 million of communication is going to get people's attention. They will reach their target. So the collective us, you and us, doing nothing is not a strategy. We have been working on a strategy, and we have been taking the appropriate steps to make sure that we try to figure out how to reach out to our customers. Let me be clear, we have not reached out to your customers, we've reached out to our customers, and that's the house accounts. Over the next few slides, I want to try to walk you through what are we doing and what do we think you can do. But before we do that, I want you to ask yourself one question. Are you doing enough? Are you doing enough? I put this slide up here because I really wanted to try to emphasize the fact that there are 3 facts that are undeniable. The connector is targeting our clients. We do pay a commission that they don't, and you will lose business. Those are undeniable facts. The numbers, and I coming from Boston, I pronounce the word numbers. The numbers are interesting. We can either debate them, we can agree to them, or we can question them. But they will represent something that we need to pay attention to. There is just no doubt in my mind that the estimates are confusing, and when we look at sort of the 25%, that's a frightening number for us, because that truly means that our book of business will shrink. And I hate to break it to the folks on the phone, but it means your book of business will shrink as well, right? What we haven't done at HSA, and I think it's obviously going to be something that we'll want to spend some time on in the near future, is sort of, this whole effort has just started. The marketing dollars are available. But we haven't looked at what's going to be the long-term effect. What's going to be the 12 to 24 to 36-month effort of this, impact of this. And so if we lose one client, if you lose one, we lose one, regaining that client is very, very difficult. So now would be the time to take action, put a strategy together to make sure that we can do everything we can to prevent people from leaving. And again, this isn't us, the collective us, against the connector. That's absolutely not the case. This is us as a business and you as a business trying to make sure that we try to identify how do we retain the clients that we have. The marketing campaign will generate phone calls. And so the question will be, what do you want to do when the phone calls either come in? We have taken some steps. We have taken appropriate actions to actually send out some communication to our clients. Our house accounts, Jeff continuously reminds me that we have to be extremely careful about how we categorize sort of who we've communicated to. But we've reached out to our house accounts. We've sent out this letter. It's just another letter that they've received in conjunction with the letters that the carriers have sent out. And it's really our attempt to try to lay the foundation for sort of this is what HSA is doing, and then we're going to follow it up with exactly, what are the next components that will be relevant in addition to the letter and the phone calls. So I want to go to I don't want to go to the next slide. I want to stay here. So we sent out the letter and we made phone calls. We made 400 phone calls to our clients. And we found some interesting statistics that came out of that exercise. We found that, we reached the people and many of them answered the phone. Why did they do that? They answered the phone because we actually called via our call center. Our call center actually identifies the calls coming from HSA. So that was very helpful for us. It also gives me the opportunity to talk about the fact that in the last year, HSA has invested heavily in our technology and our people. We have built a brand new call center. We have functionality and capabilities today that we didn't have before. So we have the capability of doing auto calls. We have the capability of doing the whole mailing and really reaching clients today that would have been very manually intensive before. Why is that important? Because we actually in a position to actually get the word out. So I just want everybody to understand that, because one of the main objectives of this call was to make sure that people understood that we will contact our customers. We will leave it up to you to contact your customers. But in the event that you feel that you need some help, we would like to offer our assistance as well. We reached 33% of the universe, which clearly exceeds the 25% that has been predicted. So we've reached a lot of people. 8 in 10 were hearing about ARPA for the first time. What does that tell us? That tells us that if you make the phone call, you get in touch with the people, you've now made a connection, you've had a touch point to let them know that we do know what's going on with ARPA, we do know how it could potentially impact you, and we are available to help you navigate through what does it mean. So that's we have found that the results are very positive based on the steps that we have taken. 31% of those we spoke to were in the medium to high risk to move to the connector. 31%. That exceeds the estimates that we've been told. So if you go back to my earlier statement that the numbers are either going to be on target, off target, inflated, underestimate, we do know that we are going to be impacted. For HSA, we are already seeing a 5% decrease in our book of business, and we haven't even seen the marketing blitz that we know is coming our way. So if we've seen a 5% decrease in business, I guess my question to everybody on the phone is, are you seeing a decrease? Maybe you're seeing an increase. That would be great, but we are seeing the effects of this exercise. So my call to action is please reach out to your clients, make the phone calls. If you need help, let us know. But again, no action will result in no positive movement. And I think now is the opportunity for us to try to continue to keep the book of business that we have, take the steps that we can before we are all caught off guard by the marketing material that will be available. So, I've said a lot. We're going to open it up to some questions. Before we do that, I think that we have a bunch of questions within the chat function. So I'm just going to put you on hold for briefly 1 minute, and we're going to try to pull the most important questions out that you've asked, and we're going to get right back to you. All right, folks. So one, thank you very much. Some great questions, some challenging questions, and we will try to answer as many of them as possible. I would say that for some of them that are strictly related to the policy and how it relates to ARPA, I do think that we will be sending out, well, I know that we will be sending out a document following the call that will speak to all of those details. So if we don't get to your question, please understand we're not ignoring it. But we did pull some of the questions that we thought would be most relevant to the entire audience. The first one, what should we do about this as a broker? We hope you will reach out to your clients, is my first statement. Just doing that shows some of the value that you bring. We know that the steps that we have taken, we have gotten feedback that it's a value add that we've provided to our clients. We would assume if you do the same thing, you will be adding value. Talk to us in advance, and we can coordinate how we might provide you assistance. So if you need phone numbers, if you need information, if you need us to make the phone calls, if you need one-on-one advice and counsel on sort of how to answer some of these questions, we are available. Naomi is available to everybody. I'm joking. Naomi's phone number is, no. I think I'm going to ask Jeff to address the next question.
Thanks, Michael. So we have a question here. Would we, or HSA Insurance, be willing to host one-on-one sessions with a brokerage office in order to discuss coordinated outreaches to clients a little bit more? And the answer is, of course, yes. We are convinced that outreach matters and can work. We've actually, I think Michael went over some stats of the outreach that we're conducting right now, and getting out ahead of this, I think, is really important, because I think one of the key things to think through is that while there will be a bunch of folks that are eligible for subsidies and will greatly benefit, and that is fantastic for them, there will be a lot of folks that will either not be eligible, or the amount of subsidy they're getting will be very slight, and that's where I think the value proposition of what we offer as a team to these clients is really important. And so yes, sitting down with brokerage offices or individual brokers and going through what we can do together as an outreach strategy is something we really would be happy to do. And also, on another point that was brought up earlier that I drilled home to Michael that he knows now and can repeat in his sleep, we will not reach out to any of your clients unless you give us the thumbs up and want us to. We greatly respect you and the clients that you've brought to us, and we would not want to be in a position to do something that you were not aware of. So just to make that clear and reiterate that. Okay.
Let me take the next one, Jeff.
Okay.
Oh, these are good questions. I think I'll bundle two of them together. How did we get clients to pick up the phone? I think I might have mentioned that. We did two things that were very fundamental to actually having a positive outcome on the phone calls. One, we sent out a simple letter in advance letting them know that we'd be calling and would be making ourselves available. The second was that when we called, the calls would show up under the HSA caller ID. So I think knowing who was calling as opposed to it just being, some type of a random call was very helpful. We found that was the feedback that we received. The next question, which I think is part of the first one, is how long did it take us to make the 400 calls? We spaced the calls out over a couple weeks. We mixed it up with all of the job responsibilities that the call center folks have. And as far as the total number of hours, the way we broke it out is we had, I would assume, I'm trying to remember the exact numbers, and we can certainly get back to you with the exact numbers, but I think that we had each individual be available for 90 minutes every day, and then we just did a rotation based on the 90 minutes. I'll tell you that the feedback that we received, folks would more likely be able to associate that we called and answered their question with a positive experience, and then if they had any questions regarding ARPA, they would more than likely call us back. So there was the cause and the effect. That's the feedback that we are most happy about. I would say that in retrospect, and this is not a negative comment towards the connector, but the problem would be if people were calling with questions and couldn't get through. We found that that was an advantage that we were able to take control over. So being able to answer the phone when they called with a question, we found that to be a positive outcome. But if they never hear from you, they will pay attention to the ad, especially if it comes at them more than once. So I think that's just a logical sequence of events, right? If they don't hear from you, they see everywhere from the newspaper to the subway station to, watching something on Hulu, then it will look very attractive to them because we assume that this marketing campaign will be very, very well done. Then we will be at a disadvantage to try to counter that. Jeff, I think I'm going to let you take the next.
Okay. How kind. So the next question, everybody, is, are you trying to undermine what ARPA is doing or trying to do? Absolutely not. That is not the intention of what we're trying to do. What we are trying to do, and the main point of what we're trying to come across with, is what we, HSA Insurance, and the broker community bring to the market or bring to your clients has a value that may exceed premium savings. In particular, those clients that have very minimal, if any, premium savings. So we're only advocating that consumers should know that value before they decide what to do next. Empowering consumers with information and making sure that they understand what different marketplaces look like and what they can bring to them is not disrespecting ARPA or the connector or undermining anything. That's good. An educated consumer will typically spend less and have better care at the end of the day. So, if we can't demonstrate our value, our collective value to a consumer who could save $10 a month, as an example, on their premium by going to the connector, then shame on us. So we just want to make sure that that comes through loud and clear, and hopefully, that summarizes our answer to that particular question. Let's see, are there any other questions? So the question is, will HSA be putting some of these talking points on our website about our value proposition and what we and brokers bring to the clients? Absolutely. We will have that posted on our support site so that you can grab it and avail yourself of those talking points at any time. And, also, we're doing a lot of reiteration here, but just to make sure it's clear, we're happy to have conversations, either one-on-one, give you the talking points, help answer questions, and help in any way that we can. We've been a trusted partner in this marketplace for quite some time, and we fully intend and are committed to being a trusted partner as we go forward.
All right, gang. Thank you very much for taking the time to meet with us. We hope that you found it informative. Again, we are available. I would like to take that a step further and say that I will make myself available for any phone calls. If you want to meet with us, if you want to come visit the location. So break out your pens. Here's my cell phone number. I forward all my calls to Naomi anyway, so it doesn't matter. But my phone number is 617-953-0133, and we will put this in our documentation. We are committed. We are committed to you. We are committed to our partnership. We are committed to continuing to do the best job that we can for our clients. And so this will be one of many webinars. It will be one of many discussions. But this summer, we plan on spending as much time as we possibly can to continue to build the partnership that will continue to build everyone's collective book of business. With that, have a great afternoon, have a nice weekend, and look forward to hearing from you. Thank you very much.